Assalamu alaikum and welcome to the Dr. UUT lectures. It's cool season, okay, winter. So what's happening actually, you might have blocked nose, stuffy nose, and because of which when you eat you don't feel, you don't understand what I'm actually eating. Means the taste is no more functional now, and due to which you may feel pain in your this particular area, this area beside the nose and above the eyes. So this area might be in pain, and due to which you might be having fever also. So what are these actually sinus symptoms telling us about? Simple. This particular condition actually tells us that we have sinusitis. Now what is sinusitis? Simple. Inflammation in the sinuses. Now what is sinuses? Very simple. Here is the diagram in front of you guys. In this diagram there is particular portion shown to you guys. Now these particular sites like here, here and here, I'm just telling you the meaning of directions, okay? So here we have actually air-filled spaces. We have frontal air spaces, ethmoid, maxillary and sphenoidal. Now all these air spaces, what happens sometimes due to certain conditions, because of some environmental factors, because of some viral attacks, because of some bacterial attacks, because of some fungal attacks, and because of some other irritants. What happens? These spaces, there is actually the lining respiratory epithelium that is actually disturbed then. What happens then? Inflammation actually seen hereby, and the air space has got a drainage point from which the fluid is supposed to move, and then from there this fluid will move to the nose, and from the nose it will move out, okay? And sometimes it may be moving down your throat. So what happens now is the fluid starts moving, and as inflammation occurs. Due to that inflammation, then this exit point of the fluid is actually blocked because of the inflammation. What happens then? Then the fluid starts accumulating hereby in the air-filled spaces, maxillary, ethmoid, frontal and sphenoidal. Now when this fluid starts accumulating here, then this fluid generates a pressure on the wall of this air-filled spaces. Now that pressure actually then causes your pain, which ultimately converts into fever then, and this blockage is actually called as sinusitis. Means inflammation in the sinuses is actually called as sinusitis. And I told you what are the sinuses. They are air-filled spaces in in these regions that I just mentioned a moment earlier. Here, here and here, okay, and some in the back. So these are the names of those regions where they are located. And what causes this particular sinusitis? A moment earlier I mentioned virus can cause, bacteria can cause, and fungi and some other irritants can cause the sinusitis. And in majority cases it is caused by the virus, okay? Now if you are using antibiotics for this purpose, you are doing a very wrong job, okay? Don't do that at all. Don't use antibiotics in the very beginning of sinusitis. If you have sinusitis, move for the saline irrigation like this in the video. Saline irrigation, and you can use some decongestants if there is stuffiness, and if there is a mucus production, and that mucus is supposed to be blocking your throat, and you are having a cough, so that cough can be removed by means of the mucolytics. And if you have pain and like that, somehow fever, for that you can use OTC analgesics and antibiotics, okay? So always use your medication as per your healthcare provider. Don't use yourselves, okay? You guys are supposed to be careful with the medication. And that's all from my side, Dr. UUT lectures.